So the Office of Rural Health was formed in 1991. We're a statewide not-for-profit, and we are the federally appointed entity to look after the needs of rural communities, specifically around health and health improvement. And we have about 40 some staff in 2 locations, but we serve the entire state. We really just act as a resource for rural communities and rural providers as they try and make their communities a healthier place to live. The Health Equity Initiative is funding by the Centers for Disease Control, and it's to South Carolina DHEC, and they partnered with us to really address issues in rural communities. But the focus was on reducing the spread of COVID-19 and to reduce health disparities related to that. So a lot of our programs and resources and our work with our partners has been really looking to decrease disparities between communities in South Carolina. So really the goal of our partnership with SCASID around this project is looking to make sure that there's fresh fruits and fresh food available in rural communities. SCASID has really strong partnerships with rural ag producers and has worked in that field for a long time. So we really partnered with them to see how we could impact the work that was being done there to look at COVID-19 precautions, but also to ensure that healthy food options were available in rural communities, so with things like hoop houses. We've been really pleased with the progress so far. The way the Hoop House project really fits within the broader collective of the grant is it focuses on that healthy food aspect and in underserved areas and making sure that healthy foods are available in rural communities. That's one of the things that our office saw when COVID first started, was there was a high level of food insecurity in not just rural communities but throughout the entire state. So looking at food access points within rural communities we felt key to really making sure that we look at the disparity piece in this grant.
Well, SCASID is a 29-year-old nonprofit, statewide nonprofit with over 150 member organizations, all of them working in local communities and helping to help the local partners improve the quality of life for their community. SCASID has always had rural members who have unique needs for the rural community to prosper. SCASID began to work with the Office of Rural Health through their Blueprint for Healthy Communities initiative, where we partnered with the Office of Rural Health on building the local capacity of residents, community groups to develop plans for prosperity for their local communities. And through that, we began to work on the Health Equity Initiative, which enabled us to capitalize on the work we had done or begun to do with community gardens, with food hubs, and with Hoop House grants that enabled us to create a network of healthy food initiatives throughout South Carolina in partnership with the Office of Rural Health. So as we provided community garden grants and Hoop House grants in 2022 in partnership with the Office of Rural Health, we were able to support 20 community gardens throughout a number of counties that are usually marginalized and of course rural counties. And we were able to provide 12 Hoop House grants to those who want to produce food year-round. SCASID's partnership with the South Carolina Office of Rural Health has a bright future. Already we're looking at ways that we can collaborate on other healthy food initiatives, economic development initiatives, and community prosperity initiatives.
So I think the Office of Rural Health and SCASID, our partnership is really going to grow from here. I think we have a lot of opportunities. Our missions align very closely. And we come at it from kind of a health improvement lens. SCASID comes at it from kind of an economic development lens, but I think they complement each other very, very well. And we've aligned some of our leadership efforts. We are aligning some of our program efforts, and I see a lot of opportunities for partnership in the future.
Really appreciate your partnership and
ab-
the work we're doing together.
Absolutely. This is hugely important for us and good for rural.
And we're going to make South Carolina the best place to be in rural.
Thanks, Bernie.
Thank you.